Okay, so tell me a little bit about yourself and how you got involved in physical therapy.
Sure, yeah, Lazo. My name's Sina, and so I became a physical therapist after I got an injury. I was in the medical field as an optician, so working with people and eyes and helping them get their prescriptions set, and making eyeglasses was another thing I did. And I just started feeling like I wanted to know more about the human body, not just the eyes. So I was playing soccer and I got an injury, and then I went and saw a physical therapist to get some help because it just wasn't going away. And it was through that experience that I realized that that was something that I would love to be able to do to help people that way. And specifically, like movement is really important to me. So that was something that I really valued getting help with and wanted to give that to other people. So once I did that, I decided to leave my job, go back to school, and actually, get into physical therapy school because it's a doctorate program. So once I got into school, I ended up coming up here to Seattle at the University of Washington. And from there, I've just been practicing as a therapist since 2018.
Cool. So like what kinds of work do you do in physical therapy? What are you doing to help, people with not just with disabilities, but with mobility issues, certain
Mhm.
conditions?
Yeah, so I mean, I see kind of a wide range of people. For the most part, I mostly work with people who have sports and orthopedic injuries. So, kind of something similar to what I had when I was playing soccer and I got injured. I help people who, have those kinds of injuries. Also, I work a lot with people who have chronic pain. So, a lot of people experience back pain or neck pain, things like that, maybe doesn't go away quite 100%. And they, kind of have to live with that basically. And that's something that I can kind of help people find management strategies for, as well as, kind of go-to exercises for when they do have a flare up to help empower them to live their life the best way that they can while also kind of managing the pain that they have. Um, and then I do work with people who, maybe it's not just a sudden injury, it's maybe a lifelong kind of mobility issue. So, kind of again, finding ways to like manage that mobility, or, working on, okay, well, if stairs are like the one thing that you would like to be able to do, okay, how can we kind of get you stronger so that you can do stairs, things like that. So, trying to find what's important to each person to see what we can make easier for them so that like those goals can be met and to stay as kind of mobile as possible for each person because that's going to look really different for each individual who comes through the door.
Yeah. So like what kinds of let me see. What kinds of stakeholders do you work on do you partner with in the physical therapy realm? Like who are your main key players in that aspect?
Hmm. Well, I would say that the top key player is going to be my patient, so the person who's coming in, and the biggest part of kind of understanding what they need is kind of doing that first session and seeing what their goal is and how we can work towards that. So that's probably like the most important key holder in my mind. And then, depending on the person, they might have like other people involved in their care. So that could be like their primary care physician, or in a lot of cases, like an orthopedic surgeon I might be working with to see if we can, work with the protocol to get the person back to what they need. Um, in some cases, it might be working with a family member. So if someone has, you know, um, maybe needs help with an exercise, like they can't complete it just on their own, they might need help from a family member or caregiver. I might work on training that person to help my patient complete the exercise, or just trying to think outside the box and basically find ways to do things that maybe you just need more help with, like from a caregiver or something like that. So those are probably like the most common people I work with as far as like the stakeholders in an everyday PT clinic. um, sometimes we have to manage insurance, so that's kind of another stakeholder there too, like as much as it is
Mm-hmm.
hard to deal with, but that can be another factor where I might have to, go at bat for a patient and talk to an insurance company about, oh, they need more visits because this is still an issue, or, we need to meet this other goal. So that might be another thing that I have to do in my everyday job of trying to advocate for my patients with the payer of the services that we provide.
Mm-hmm. Yeah, if I could ask, like, what impact does physical therapy have on, the greater community, the disability community? If
Mm-hmm.
you could just explain that.
Yeah, for sure. I mean, I think as PTs, because we specialize in movement and mobility, that's a can be a huge aspect for, you know, helping everyone kind of navigate our community physically in a way that is, accessible for everybody. So, as PTs, we kind of think of, how can we, you know, one, like help someone accomplish that with, their own body. And then if that's not possible, maybe like what other kinds of tools can we use to like make that possible so that we can, everyone can be as like uh like functional in our community as possible.
Mm-hmm. Yeah. Lastly, how can physical therapy, improve the lives of people with not just disabilities, but with other conditions?
Mhm.
How does that help? Um,
Yeah, that's a good question. I think when I think about being a PT and like how I get to help people, I think of it a lot of just trying to use your own body to um, to do the thing that it's supposed to do. And sometimes that means, taking a step back and, taking things slower than maybe you would naturally would. So a lot of times in like a normal healing process, if you push too hard too fast, then you can delay healing or delay your progress. The same goes for, a lot of chronic conditions too. If you do too much too soon, then that can flare things up, right? So um, I find the value of a physical therapist in, recovery is like a way of kind of helping people go through those natural progressions, but kind of just being a guidance to that in a way that's like evenly dosed and not too much too soon, but just kind of like the right amount, and letting the body like do what it's good at, basically, but not too much. Does that make sense?
yeah, it really does. Those are some important points there.